I'm going to go ahead and move on to the neck. First, just checking for symmetry, noticing any jugular vein distension, any visible palpations, which I don't. So I'm going to go ahead and palpate his lymph nodes. And you let me know if there's any pain or tenderness. Do you have any pain or tenderness anywhere I'm touching? Okay, good. So now I'm just going to palpate the carotid. I'm going to do one at a time as to not include blood flow to his head. Okay, that seems to be good. So now I'm just going to check his trachea, make sure it's midline. So I want to have him lift his head up for me. Thank you. And I'm going to follow his trachea up. And his trachea seems to be midline. Also, I'm going to have you kind of look towards me again and swallow. Good, equal swallow. So now I'm going to palpate his thyroid, or attempt to palpate his thyroid. So for that, I'm going to use the anterior position. So I'm going to have him turn around. Okay, and I'm going to have him lift his head back and over to the side and swallow. And then to the other side. And swallow. Okay, and so I don't really feel any masses or lumps with that, which is a good normal finding. So I'm going to go ahead and have him face me, turn to face me again. Okay, so now we're going to go ahead and move on to his chest and pulmonary assessment. So I'm going to just have him take a deep breath and exhale. Okay, that seems to be good. Symmetric expansion. Do you have any history, any lung history at all? Any trouble breathing, allergies? No. Okay, good. And so now I'm just going to go ahead and palpate. Do you have any pain or tenderness at all when I'm touching? Okay. I'm going to have him take a deep breath in. Now. Okay, and then with that, my hands both moved up symmetrically and then came back midline, which is a normal finding. Now I'm just going to go ahead and do, going to have him say 99 for me. And I'm going to feel for the vibrations, making sure that they're good and symmetric. So go ahead and say 99. 99. And his vibrations are good and good on both sides, so it's more important that they're symmetrical than they are present. So that's a good normal finding with that. And that test is called, it has a name. It is called the and that test is called the tactile feminist test. So now we're going to go ahead and move on to percussion. So I'm going to, with my non-dominant hand, hold it down and go to percuss over areas. And so I should hear more of a hypersonic sound and not dull. If I heard a dull, it's probably because I'm over a rib. So. Alrighty, so that's good. Hypertonic sound, not really dull, which is a normal finding. So now I'm going to go ahead and move to auscultation. Okay, so we're going to have him take a deep breath in and out every time I move my stethoscope. So, deep breath. And then we're going to go ahead and move on to the whispered the whispered tetraloquy. So I'm basically going to have him say 1, 2, 3 while I'm listening with my stethoscope, and I really shouldn't be able to hear anything. It should just be kind of sound muffled. So I'm going to have him say 1, 2, 3 whispered when I move my stethoscope. Okay, that's good. I don't really hear. I can tell his lips are moving and he is speaking, but I don't really hear it very clearly, which is a good normal finding. If I was able to hear it clearly, that shows areas of consolidation, which is abnormal. Okay, so now I'm going to go ahead and move on to bronchoscopy. So I'm going to have him say 99 while I'm moving my stethoscope, and I should be able to hear that very clearly at the end. Okay, so I wasn't able to hear that very clearly, which is a good normal finding. So now I'm going to go to endoscopy. So I'm going to have him say E every time I move my stethoscope. So just say E whenever I move my stethoscope.
Two run-throughs. My Cody's wasn't okay, but it wasn't great.
Okay, and that is like a normal E sound. If I were to start hearing more of an A sound, Crane, you doing okay? Okay, if I were to start hearing an A sound, then I would be an abnormal finding. So, and I did start the E, so that's good. So, good with the anterior. We're going to go ahead and move on to the posterior. We're going to do the same thing on the posterior side. So, I'm going to turn around. So first is going to do inspection first. So just going to have him take a deep breath in and out. Just looking for normal expansion. I'm going to now palpate. Do you have any pain or tenderness?
I do not.
Okay, so no lumps are noted. I'm just going to have him take a deep breath in and out again. Okay, and again, my hands went up and out equally and came back midline, which is a normal finding. I'm going to go ahead and perform the tactile firmitus test. So again, palpating that. So I'm going to just feel vibrations. I'm going to avoid the scapula area because I wouldn't really feel anything. So I'm going to have him say 99 every time I move my hand. So
99.
Okay, good. So I was able to feel the vibrations good and equally for both sides. So now I'm going to go ahead and move to percussion. So I'm going to percuss, again, avoiding the scapula areas. So we're going
And for the patient, you actually want me to carry.
Okay, so that's a good normal finding, not really dull or anything, which is all good. So now I'm going to go ahead and move to auscultation.
Suction valve and everything. And make sure it's satisfying, make sure there's no.
And I'm going to have him take a deep breath in and out every time I move my stethoscope. So take a deep breath in and out for me.
In orders to take suction, it's to that jump out so you can go ahead and do it.
I'm going to
Okay, and that's good. And so we're going to do the same test that we did on the anterior side. So we're going to perform those now on the posterior side. So we're going to do the whispered ventriloquy again. So I'm going to have him say 1, 2, 3 every time I move my stethoscope. So.
so she doesn't have any obvious
and I wasn't really able to hear that. I mean, I was able to visualize his lips moving, but I really wasn't able to make out 1, 2, 3. So that's a normal finding. So now we're going to go ahead and move on to bronchoscopy. So I'm going to have him say 99, and I'm going to listen for that. So. Okay, good. And so I wasn't able to really make that out very clearly as well, which is a good thing because if it was sound more clear, that would indicate areas of consolidation. So now I'm going to go ahead and move on to egopathy. So I'm going to have him say E, and I'm going to listen for that sound. So say E every time I'm in my stethoscope.
E. Alright, and so you smile, close your eyes. I used to take my pen light, and I would check for the...
Okay, and I hear normal E, not really an A sound, which is good. And that's a normal finding. If I were to hear A, that would be abnormal. Also, when I'm listening to his lungs, I just noticed like his good, clear bilateral breath sounds, no adventitious lung sounds noted. So I'm going to have him turn around and face me, and I'm going to check. I'm going to check his heart tones. So with this one, I'm going to be checking his four areas: his aortic, his pulmonic, his bicuspid, and his mitral. So with this, I'm going to use both of the both sides of the stethoscope for this. So. Okay, I'm going to use the bell side. Okay, and I hear a good, consistent lub-dub sound, so that's a good S1, S2. I don't really hear any murmurs, and it does seem to be a regular rhythm. So now I'm just going to go ahead and count out his heart rate, and I'm just going to do that by listening to his mitral valve.
Okay. So.
Alright, and it seems to be, his heart rate seems to be at a good 64, which is normal. So that concludes the first half of our assessment. Thanks for watching.